So in this video, we're going to talk about a urinalysis. So first of all, when we're collecting a urinalysis, we want to make sure that our patient is given at least 30 to 50 milliliters of urine. And so if you look at the specimen cup, there is measurements on here. And so this shows me 20, 30, 40, 50, 60 milliliters of urine. If we have too little, it's going to be difficult to get our squares of our reagent strip covered and get accurate results. If it's too high as well, then we risk spilling the urine. They do have lids though. Okay. So that's a urine cup. You would want to make sure that the patient knows to put their name and their information on here. So when they leave this in the bathroom, there's no mix up of specimens. We know who belongs to who. This is a bottle of our test strips. So these are called urinalysis reagent strips. And so these would be used to actually test the urine. One of the strips I'll pull out here. We always want to check that expiration date too of our strips. So down here we have our expiration date. So this is what our strip looks like. And you'll notice that I put the lid back onto the bottle right away, and that's because these strips are sensitive to light. So I always want to be sure to keep them in a dark container, like this one's all black, it's not see-through, with the lid tightly closed, keeping the light out so the light doesn't alter the color of the little reagent squares on my strip here. You also notice that there is an empty area without squares down here. That's meant so that I can hold this without touching those little squares. Again, I don't want to touch the areas on this strip because I could contaminate my specimen results then. Now, if I look at this and compare it to the bottle, you'll notice that these squares with the first line here match up pretty closely. That very bottom green maybe isn't the same exact green, but these are the colors, and this is the chart that we're using to compare. So when I hold this here, when I'm reading the results, I start at the bottom and I work my way up. And so when I start at the bottom, like for example, this square right here, this bright teal green color, that's for glucose. So when I'm testing the urine and I move over, what I'm looking for is which square and which color in this row matches best with this square. Then I move up the line to the next one, which we can see here because this hasn't been tested yet, is just white. And so then once I test it, I would move this along and see which color in this row matches with it. This row is not all, by the way, the normal area. This, you will find a lot of the negatives, but this is just the baseline area. So like for specific gravity, for example, it starts at 1.000. Normal specific gravity should be between 1.003 and 1.030. So this actually would be an abnormal, but it's in the first column because it starts numerically with the number 1 and moving down the line up it goes. So again, this doesn't represent our normals. It's just the base where things start from. And then again, we move over down the line. And so I start at the bottom and I work my way up. Now, the reason why I start at the bottom and I work my way up is for timing. I need to dip this urine stick into the urine, and then I'm going to wait 30 seconds before I begin reading. And that's because each one of these different squares, I'm supposed to wait a different amount of time before I begin reading. Now, I really only need to set one timer though, because even though glucose might be 30 seconds and the next one 45, so on and so forth, all the way up to leukocytes, which would take 2 minutes. It would take 2 minutes before I have those results, 120 seconds. Then what I can do is, instead of setting all these different timers, I set it for 30 seconds and I begin reading. By the time I've read this one with comparing the colors, it will have been 45 seconds. And then as I continue going up reading each one, by the time I get to the top with the leukocytes, 2 minutes would have passed and it would be okay for me to record those results. I also do not want to wait longer than the time that's occurred for each one, because once it goes past that time, changes will continue and alter the results. So now we're going to actually do a urinalysis. So what I'll do here for a physical urinalysis where I'm not using a computer to aid, the first thing I would do is my physical inspection of the urine. So this is freshly voided urine. If this was not freshly voided, I would want to make sure to refrigerate it within an hour of the patient voiding. So again, if I can't test the urine within an hour, it should be refrigerated. Then before I go to test it, I would pull it out of the refrigerator and give it about 10 to 15 minutes to come to room temperature. It's a small amount of fluid. It doesn't take a very long time to return to normal temperature. Give it a little swirl, make sure that cap's on there tight. Give it a little swirl to mix everything back together. And then I want to observe it. So now I'm going to look at the urine for what the color is. This one I would classify is a light yellow. Then the next thing I would look for is the clarity of the urine. How well can I see through it? Personally, I like to use the label on the other side at how well, when I'm looking through this side, I can see that label to know whether it's cloudy or clear. This one looks slightly cloudy to me. Not very cloudy, but there is a little bit of cloudiness to it. And remember that cloudiness in a freshly voided specimen would be indicative of a UTI. However, cloudiness from a specimen that's been sitting out is from the growth of the microorganisms and is not a true indicator for the patient. Okay, so now I've done a couple of my physical. I'm going to open this up. And now we're on to the odor. No, you don't need to stick your nose in there. It's not a glass of wine. I'm not trying to see how fruity it smells. But when I take the lid off, if there is a very strong foul odor, I would want to note that. That again would be indicative of a UTI. If there's an ammonia odor, I would want to note that. However, ammonia odors typically come from letting urine stand for too long, which means that we didn't preserve the specimen properly. If there's a fruity urine, that fruity smell to the urine, that could be indicative of uncontrolled diabetes from the additional breakdown of ketones, fats in the urine. Now, after you've performed your physical properties of color, clarity, and odor, then I would move on to the strip portion. So this is where I would take my strip out of the bottle, being careful not to touch those squares. And then I'm going to dip my stick into the urine. Now, this isn't a hot tub. The strip is not meant to just hang out in there. I want to leave it just long enough that I cover all of the squares. If I let it just hang out in there, I'm going to end up with too much urine on my strip and all the colors are going to bleed together. I'm going to have to tilt the urine cup to help me cover all of these squares. So if we watch here, I go in, I tilt, get all the squares covered, and then as I pull it out, I pull it against the lip of the bottle to get excess urine off. I want to be sure to hold this horizontally so I don't get any bleeding of the colors. And I'm going to time it and wait my 30 seconds before I begin reading. Once 30 seconds have passed, I hold this to the bottle without letting it fully touch the bottle. I like to use another finger to help prop me up. And then I just compare those colors, writing them down as I go. Once I'm done, the urinalysis strip is regular trash. I would dump the urine down the toilet, so that goes in the sewer. And then the urine cup and the lid that's empty would go into regular trash as well. Now, I am going to show you one more thing though, two more things. So sometimes the doctor wants us to send the urine out to the lab for urinalysis instead of doing the urinalysis in-house. If that's the case, then I need one of these kits. This kit comes with a urinalysis tube, which you can see is this like reddish orangish color mixed with the yellow. So this is what we call a marble tube. It also comes with a straw here. This straw has a plastic needle holder that's attached because there's a needle inside of there. So we want to be very careful when we're holding this. So if we look inside here, you can see that needle that I was talking about. And we want to make sure to be very careful. If I stick my finger in there, that's going to hurt. That's meant, that needle, to go into this rubber stopper of the tube so that the urine can be collected inside of here. Now, what I want to make sure to do first, though, is to get my straw into the liquid, into the urine. If I don't do that first, if I attach the tube right now, the vacuum that's inside of this tube would suck the air from the room and fill the tube with air instead of urine. So I don't want to waste the vacuum on that. So I'm going to put my straw into the urine, and then I'm going to place my tube onto this and push down. As I do that, you can see that it fills with urine. So we can see that the urine is now inside of this tube. I could give that a couple turns to invert it and mix the additive to preserve the urine that's in here, well, for the lab. Now I'm gonna just sharps this. Your straw with the needle holder would also go into sharps because there is a needle on that. Now, the doctor sometimes also wants you to send out for a culture and sensitivity test. So a culture is where we're determining what microorganism is causing infection. And then a sensitivity test is to determine what antibiotic would be used to treat that infection from that specific microorganism found from the culture the best. Now, the laboratory, the pathology department at the laboratory would be the ones to perform the culture and sensitivity testing. So I need to get my specimen to the lab. To do that, I would use a technique that's very similar to the urinalysis. The difference is my tube. With this tube, you'll notice that it's gray. It's a bit smaller, and right on the label it says urine C and S preservative, culture and sensitivity. So this tube is meant specifically for that. This tube has a powder additive in it, and sometimes that can get stuck up at the top of the tube. If that does happen, just give it a couple taps with your finger to loosen the powder additive up. Again, I'm gonna place the straw into the liquid, and then I'm gonna take the rubber stopper of the tube, push that onto the needle in the liquid. That will fill my tube with the urine, as we can see here. And then I give it a few mixes until I ensure that that powder preservative has been dissolved into the urine specimen so it stays preserved until it reaches the lab. And then again, the straw with the needle would go into our sharps container. And that concludes our video. Thank you.